Kindly introduce yourselves.
My name is Grace. I'm a participant in this activity.
I am Mary, and I'm glad to have been here participating in this event.
Can you tell us why you decided to participate in the diabetes walk today?
We realize that diabetics have become a very big challenge for most of the people, most families. And now diabetes is not only about lifestyle. Even small children now are being affected, and therefore it is very important for people to come out and support the cause, because it is a worthy cause that is supporting even children who are very young, and that's the reason we came out.
Is this your first time participating in this event?
Yes, this is our first time. I think a lot of awareness still needs to be given, because a lot of people don't know that something like this is happening. So yes, this is our first time.
What motivates you to support diabetes management and information initiatives?
We feel like it's a worthy cause. It's a cause that if everyone comes out to support, then these people who are suffering diabetes will have a future, because you know it's very expensive to manage. It's a very expensive disease to manage. Having to inject insulin every day, I think it's expensive for families. So if we can come out to support diabetes, the management of diabetes, I think the people who have brought up this cause, the people who decided that they want to start supporting this cause, will be able to reach a lot of people, not only in Nairobi, but even in the rural areas. So I think that's why it's very important that a lot of people come to support this.
Do you know someone, or are you the one who is diagnosed with diabetes?
I know that my mother is suffering diabetes, and every month we have to spend beyond 10,000 to support her. And I think this is something that is it's not an easy thing, so it requires a lot of resources, and these resources sometimes don't come very easy. So if we can collectively come together to pool the resources, then we will be able to support people who are suffering diabetes.
How have you been supporting your mother to support diabetes?
Besides nutrition, we have to buy medicine, and the medicines are very expensive. That's what I said. We spend beyond 10,000 every month to be able to buy medication for her. Besides the fact that every other day there has to be a routine check. So when you consolidate the cost of managing this disease, it's not something that is affordable for everyone. And that's why I think the diabetes, the DMI must be supported to support many more patients who maybe cannot be able to reach this. And that's why I came out.
What reforms would you love to see the government doing to ensure diabetes management is increased in the country?
I think apart from awareness, the government has to be able to support people who are having diabetes, because at the moment, it is at a personal level. When you have a patient suffering diabetes, it is your call. It's you to take responsibility. The government hospitals will not be able to manage everyone who is suffering this. I think just like critical diseases, I think it is important now for the government to have a focus on this disease, which is also going down with so many people. Today I spoke to someone who told me they've lost 3 people in the family out of this. So I think it should be given the focus like all the other it's not a lifestyle disease anymore now. It's an illness.
What do you think about the organization and activities of the walk today?
I think the organization is doing a good job. It started in 1990, and you see they've stood the course up to now. Even with COVID, they are still able to come back, and I think it attracted quite a number of people, including children, and that is something that should really be encouraged. And I think the organization should also see a way of doing this out of Nairobi, maybe in other major cities, so that people out of Nairobi can also get the same support that people in Nairobi are getting. Because I think this is not a disease for opulence. It's not only happening with people who have the means, but now it's also affecting even the people who don't have means. So I think they need to move out of the city to the rural areas as well.
What aspects of the event did you enjoy the most?
I enjoyed the dance, I enjoyed the walk, I think the planning was awesome. They did a good thing in planning. It started well. The weather also favored us today, that it was not hot. So, and the kilometers were not so long, so even young children were able to participate. And I think they really did due diligence in organizing and ensuring that it's a success.
Was this the longest walk you've ever had?
No, I think we participated in many walks, Standard Chartered. We were at the Lewa Marathon. So I think this is not the first, but I think all of them have a different course. And for this one, this course was perfectly organized.
Is there anything you would like to see improved or added for future events?
I think maybe today I saw like there were stands for different activities, and I think maybe if they can have a stand with equipments and a stand where people are going to get information about how to manage. Today I saw there was ophthalmology. I didn't get a chance to walk in all the stands, but if we can have a stand where they have the equipment for testing, different equipment for different stages, I think that will go, and the equipment even sold at a subsidized price. I think that will go away in supporting people who come for the walk and also are suffering the disease.
Are there any specific topics or issues related to diabetes that you wish were covered more in depth?
Yeah, I think maybe they should talk more about even how to identify you have the disease. How do you know that you are suffering diabetes? Because I think diabetes comes and it just hits you and you don't know, it doesn't give you warning. So what should you look out for in your day-to-day life that can help you know that now I'm at a point where I can actually get the disease. We know that obesity and maybe nutrition are some of the causes, but there are other underlying causes that we also need to know besides nutrition and being obese, because I've seen so many people who are fit, but they still suffer the disease. So I think it is important that when something like this is happening, we are given a little bit of knowledge on what to look out for. Not a long talk, but just something, a snippet of what to look out for what to always look out for to be able to know that you are likely to suffer the disease.
What resources or information provided today did you find the most helpful?
I think today I missed quite. Maybe I think in terms of information, a lot should have been given out.
How do you feel about the sense of community and support at this event?
I think the community is I think DMI has really organized it in a way that probably they also have a list of people who are suffering the problem, and that list maybe we are not privy to, but I'm sure a lot of the people who participated are one way or another affected or infected by the problem.
Have you connected with any support groups or networks through this event?
Today I didn't get a chance to, because after the walk I couldn't carry my legs. So maybe if I knew I was not going to be able to move after that, I should have done my networking earlier before I went for the walk. But I thought I would come back strong. Unfortunately, I came back weak, so I didn't get a chance to network.
What are some of the biggest challenges you face when helping your mom manage her diabetes?
The biggest challenges I face is actually cost. And being that she's elderly, even the nutritional bit of it is difficult, because she already has formed a certain pattern in her nutrition. To get her out of this pattern becomes very difficult. And the fact that she's in the village, and I'm at work in the city, there is no one to follow up because the hospital, there is no social workers who can go and even, work with her on a day-to-day basis. So that I find is a challenge. So maybe that is also something that needs to be taken into consideration. That the people who suffer this disease in the rural home, especially the elderly, we need some social workers going to the homes to talk to them, to see what are they doing. And like me coming from Nairobi, and I don't have a medical background, so I can't support her much. So we need to have some people trained on how to support those who are suffering this disease in different parts in the 47 counties of this country.
What tips or advice would you share with others managing diabetes?
Sorry?
What tips or advice will you share with others managing diabetes?
I think I was very encouraged by the doctor. The doctor who said he realized he had diabetes at a very early age, but that has not stopped him from achieving his goal and being a doctor. So I think such kind of information is powerful. The people need to know that having diabetes is not a nail in the coffin, that you can have diabetes and still live a normal life if you're given the support that you require.
His name is Dr. Andoga.
Or Dr. Andoga.
Andoga. Dr. John Okoth Andoga.
Yeah, I was very encouraged by Dr. Andoga's testimony of how he has lived a normal life despite the fact that he has diabetes. I think that is really something that should really be given out to many people so that people don't think if you have diabetes, that's the end of life. You still can live a normal life if you just know how to manage it. But of course, we need people who can teach those infected on how to manage and live a normal life.
Will you be interested in participating in future diabetes awareness and management events?
Oh, yes.
How do you plan to continue supporting diabetes initiatives throughout the year?
Throughout the year, I think now I know better. I understand, I know better, and now I'm also well informed on the fact that one can have diabetes and still live a normal life. So even my mother, I'm going to encourage her that she needs to get out, because I was afraid that now she has to stop living her normal life because she's sick. But I've since realized that it's not sickness, it's just a condition that if managed, one can be able to live a normal life. And I think that is that is what I'm going to carry to anyone who is having the problem.
Do you have any suggestions for how we can better support individuals living with diabetes?
I think besides awareness and this ensuring that we train as many people as possible to be able to work with families that have diabetes patients, I think that is something that we really need to put focus on, that we create a lot of awareness and we train people who can work with those who are affected and infected.
Final question. Is there anything else you would like to share about today's event?
I'd like to thank DMI for putting up such a beautiful event, and even to allowing all of us to participate, those who are suffering the disease and those who are just well, so that we can learn from each other. And I'm praying that they can be able to multiply this in all the 47 counties so that we can be able to support those who are having the disease, so that they can be able to live a normal life, because it is manageable. And I think sometimes even it can be cured if it can be arrested if it is known in good time. So I really want to thank DMI for starting such kind of an event. And I know once they grow and they multiply it to the different countries, a lot of those who are suffering diabetes will be supported.